Question 3, Stuart McMillan.
Thank you, Presiding Officer. To ask the Scottish Government what dialogue it's had with NHS Greater Glasgow and Clyde regarding a replacement for Port Glasgow Health Centre.
Cabinet Secretary.
Thank you, Presiding Officer. The Scottish Government meet regularly with colleagues from NHS Greater Glasgow and Clyde, and they are due to meet with the Assistant Director of Infrastructure Planning and Delivery on the 13th of March. A wide variety of issues will be discussed, including the Board's primary care priorities, which we know will include Port Glasgow Health Centre. Following the UK spending review, the Scottish Government intend to update and publish a refreshed infrastructure investment plan, which will outline what capital projects can and will be taken forward.
Stuart McMillan.
I thank the Cabinet Secretary for that reply. And replacing Port Glasgow Health Centre is a key priority for my constituency. It would help deliver better outcomes for patients and also provide a better workplace for staff. And I think if you only have to look at the Greenwich Health Centre replacement at £21 million, that proves the point. But will the Cabinet Secretary accept an invitation to visit Port Glasgow Health Centre to see the condition of the existing building alongside NHS Greater Glasgow and Clyde's new Chief Executive to see why a new facility is so urgently needed?
Cabinet Secretary.
Thanks, President Officer. I thank Stuart McMillan for his question, for highlighting the investment the Scottish Government and the Board has made in the new Greenock Health Centre and the obvious impact that that has had. And of course, more than happy to accept such an invitation to visit Port Glasgow and acknowledge the importance of this to Stuart McMillan and his constituents. I'm fully aware of the need for additional primary care investment, not just in Port Glasgow but further afield, and I understand it as one of NHS Greater Glasgow and Clyde's top priority primary care priorities, if not the number one. And as I'm sure, Presiding Officer, you'll be aware, the capital funding position remains challenging, but I'm working closely with the Finance Secretary on the refresh of the infrastructure investment plan, the results of which will be published later this year, so we can set out what we can do to address the situation in Port Glasgow and with other primary care facilities across